Of Woodbury County employees are concerned about looming changes to their health insurance plan.
That's right, and they were actually so concerned they filled the seats at the Woodbury County Board of Supervisors meeting tonight.
County Board Chair Dan Bittinger says around 75% of the county's more than 400 employees take advantage of the health insurance plan offered by the county. KTIV's Connor Trett was at that meeting tonight. And Connor, why is the county considering changes?
Yeah, Matt, well, at the meeting tonight, they said that the county has been operating at a deficit for the past several years. At the county supervisors meeting tonight, the county made it known that this last year, the county had $6.7 million in contributions by employees compared to $8 million paid out in claims. So County Board Chair Dan Bittinger said a change is needed to allow for a sustainable health plan. Here's how the proposed policy shapes up for Woodbury County employees. Now, this excludes sheriff's deputies who are represented by a union, but for preferred provider organization plans, individual deductibles increase from $250 to $1,000, and family deductibles increase from $500 to $2,000. For health maintenance organization plans, individual deductibles jump up from $250 to $500, and family deductibles go up from $500 to $1,000. Calendar year out-of-pocket maximums also increase. For PPO plans, it goes up from $750 to $3,000 for individuals and from $1,250 to $6,000 for families. HMO out-of-pocket maximums also go up from $750 to $1,500 for individuals and from $1,250 to $3,000 for families. Now, in both plans, the amount employees pay for co-insurance, inpatient and outpatient coverage, diagnostics tests like x-rays and blood work, and imaging like CT scans and MRIs doubles from 10% after the deductible is met to 20%. Now, more than a dozen county employees came to speak to the board tonight and voiced their concerns over the proposed rate changes. Many say the county's benefits package plays a crucial role in employee recruitment and retention. Others acknowledge that while rising healthcare costs have made the current system unsustainable, the short notice and drastic increase to their rates came as a shock.
And I understand healthcare has gone up, and it's got to get addressed somehow. But I don't understand why it's tripled as far as our out-of-pockets and deductibles.
I mean, nobody wants taxes to go up, but that's taxing the people that are doing the work for our county. I mean, that's completely negating any type of raises or wage increases they might have got.
Now, ultimately, the board decided to table this item to a later meeting and will continue to discuss changes they can make to the health plan.
Everything's on the table to look at. Our employees asked for some other options like an HSA account and different deductibles and out-of-pocket maximums. And so we will look at all that and see what can we do. But at the end of the day, there will have to be changes. There will be changes to the health benefit plan just to be able to keep up.
Now, again, no action was taken on this item tonight. The Board of Supervisors agreed to discuss the issue at a later meeting. The deadline to make any changes to the county's health plan is December 10th. Board Chair Dan Bittinger says that's so employees can get their insurance cards before the first of the year.